Welcome back to Made to Be Whole. This week, we're going to talk more about urinary tract infections in both women and men, the limitations of current testing and treatment, and what you can do to get in your best bladder health. Stay tuned.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So today I want to discuss urinary tract infections, also known as UTIs or bladder infections. Sometimes in men, it's really a prostate infection that we're looking at. It's interesting. They're definitely underdiagnosed and undertreated, and they have a lot of potential long-term negative health consequences outside of urinary tract health. And if you don't think, however, that urinary tract health is enough, have you ever been tied to the bathroom because you had to run to pee all the time? I mean, it can really throw a wrench in your plans and affect your quality of life if you are constantly having to pee, if you're up all night peeing, if you have to be thinking about the bathroom all the time and planning your life around proximity to a toilet. You would probably rather do without that and might be able to learn a little bit from our discussion today. So I frequently hear people, when I talk about screening for these urinary tract infections, say, well, I don't have symptoms. And what they mean is that they don't have pain. But we know that pain is a symptom, and that with chronic infections, that overt pain is not always present. And in addition to that, sometimes you have people who have had pain for so long that it becomes their normal. They don't even recognize it as pain. It's more of a pressure or discomfort at that point to them. One thing that I frequently discuss, and I may have mentioned it on the show before, is that with UTIs, you have these two extreme sides of the spectrum and no recognition for the middle ground. So we've come to a point where I feel like a lot of healthcare treats urinary tract infections as not a big deal. You don't need to treat unless you have severe symptoms, or if you do treat for 3 days and you'll be fine. But on the other hand, we know that an untreated urinary tract infection in an older adult, for example, can present as worsening dementia or psychosis and can lead to sepsis and even death. Well, that infection didn't begin as this raging thing. It started a long time ago and wasn't adequately treated and progressed to that point. There are a lot of factors that can contribute to that progression, but my point is we want to be treating earlier in the spectrum so that we don't see that dramatic and really devastating complication that can happen. Because when you get to someone who's older or who is medically fragile for other reasons, sometimes treating the infection doesn't bring back all that's lost. There can be a real loss of function once that occurs. The different ways that urinary tract infections are treated, typically you will go to your provider's office, you pee in a cup. They might do a dipstick, which is just a little piece of paper with reagent on it that indicates whether or not there's protein, glucose, bacteria, blood, leukoesterase, nitrates, different indicators of the health of your urine that can be a trigger to do follow-up testing, which is typically a urine culture. So if we talk about that, first of all, those dipsticks aren't very sensitive. They can catch things, but just because you have a negative dipstick doesn't mean everything's okay. But even if you move on to that culture, there are a lot of limitations with culture. And one of the things that I read that was really important. And I thought, oh, I don't know why I didn't think about that. There are culture negative infections in other areas of the body. For example, there are people with sepsis who have negative blood cultures, but they clearly have all the symptoms of sepsis, which is life threatening. And when they're treated, they get better. So if you have someone who has a quote unquote negative culture, but they have all the symptoms of a urinary tract infection, that really merits further investigation. Secondly, the problem with cultures is that they can't easily detect these polymicrobial infections, meaning that many infections have multiple pathogenic microorganisms, meaning there are a lot of bugs in there. And when you do a standard culture at the hospital, it might pick up two or three, but a lot of times what it will say is it's a contaminated sample. And then, of course, it's the woman's fault because she doesn't know how to wipe. And that's why she has a contaminated sample. This is how I was trained. This is what women are told all the time. And it's really pretty darn insulting because, first of all, if all of that bacteria is present just at the opening of the urethra, that's probably alarming. But also, most women do know how to wipe. They can follow directions when getting a clean catch. And if they have symptoms and they have abnormal bacteria, then they deserve treatment. Other things that culture can't do, it's less effective at detecting certain types of bacteria. So non-aerobic organisms, things that are slower growing, gram-positive organisms. They don't do a great job detecting when there's a smaller colony count. There are a lot of really unique organisms out there that we're finding through better testing that aren't accounted for. And it doesn't do a great job detecting organisms that might be in the biofilm. So we've talked about biofilms in the context of Lyme, Bartonella, Babesia, these vector-borne infections. But biofilms are present in pretty much all chronic infections, regardless of the bug or the location of it. So if you have bacteria that's trapped inside a biofilm, it's probably not going to be detected on culture. One thing that I have learned in the last couple of years as I've become more familiar with this and studied more and been treating people is that there are a lot of chronic conditions that actually are urinary tract infection. And that's exciting because these are conditions that we were told there was no treatment for. So frequently when I have someone with incontinence, I will detect an infection if I do some really good testing. And we've had patients whose incontinence has resolved once we treated the infection. And it wasn't just because they needed to do more Kegels or they had had too many babies, XYZ. There was actually an infection there. And because of that, they had decreased bladder control and were incontinent. And that's a real damper to quality of life at any age. Another thing that we are finding more and more does involve infection is something called interstitial cystitis. If you haven't heard of it, it's kind of worth a bit of a Google search here. So interstitial cystitis is a really painful chronic bladder condition that is, I will just read you the answer from ChatGPT here when I do a search. Interstitial cystitis, also known as bladder pain syndrome, is a chronic condition characterized by bladder pressure, bladder pain, and sometimes pelvic pain. Symptoms can range from mild discomfort to severe pain and may include frequent urination and urgency. The exact cause of IC is unknown and is often confused with urinary tract infections, although no infection is present. While there is no cure, various treatments can help manage symptoms. So first of all, it's a syndrome. And you may have heard me say before that syndromes are BS. Beware of syndromes, because a syndrome is just a group of symptoms that happens together that somebody drew a circle around and said, we're going to call this a diagnosis and let's come up with some expensive treatments that insurance might cover to alleviate the symptoms. But there's very little push to find the actual root cause. So we are finding with some people with interstitial cystitis, which is more common in women than men, some of these really chronic, complex infections that we're talking about. So if you're frustrated and you say, well, what am I supposed to do? That's a really good question. And there's actually some really good testing out there that a patient first introduced me to. And then I started to order these, consulted with pharmacists, found out about different tests, but that looks more at PCR testing and next generation sequencing. So, what that is, PCR testing, you may have heard that phrase around the COVID era because people would talk about, oh, were they PCR positive? But PCR stands for polymerase chain reaction. It basically takes the DNA of the microbe or the pathogen, the bug that's causing the infection, and it amplifies the small sections of it so it can analyze the genome. So it is really very accurate and effective because we're looking at the actual DNA of the pathogen to identify it. And I'm saying pathogen instead of bacteria on purpose because I have found in some of these chronic presentations that in addition to bacteria, we'll find fungal infections that are driving symptoms. So there are different types of bugs that can get in there and grow. And if you stop and think about it, the bladder is the perfect place for an infection to flourish. It's dark, it's wet, and it's warm. So it is not difficult at all to imagine some pathogens making their home inside that bladder wall. And when you think about biofilm formation, the biofilms adhering themselves to that biofilm wall. And biofilms are complex, but then also what we will detect is that there are layers of infection. And so we find as we treat that we will clear some bacteria and then other ones are there. And it's not because somebody has a new infection, it's because we've peeled away a layer and we're finding what's underneath. And so the treatment can be prolonged if it's a chronic infection. I want to give another shout out for testing methodology to NGS, which is next generation sequencing. So it's a non-targeted testing method that uses RNA or shotgun sequencing to detect microbes from a database of 50,000 organisms, depending on the lab. So they're looking at all of these strands that get independently sequenced. And so we've got this frame of reference to identify what's there instead of your culture, which has a much more limited reference library, I guess you could say. And if it comes back with something they don't identify, that's another time that they'll trigger that basic accusation like mixed microbiota, contaminated sample, collect another specimen. So that type of testing to me is key to getting an accurate diagnosis so that you can do accurate treatment. There are other testing methods, but those are the two that I use the most. The company that I rely on the most, I have mentioned on other episodes, it's Microgen. Their website is microgendx.com. They have a lot of good information there. I've been a little disappointed though, not with their test at all, because it's fantastic, but with the response that some other providers have had when my patients have taken them results. They'll hold up the results and say, "What's this? That doesn't mean anything." Well, the bladder is in a sterile environment. Everybody has bacteria, no big deal. And there's not that intellectual curiosity to say, I haven't seen this before, but this is pretty interesting. Let's look and find out more. Microgen does have some really good educational resources on their webpage. Another really great resource that has educational materials for both patients and providers is a website called liveutifree.com. And they have a clinician resource that you could take to your doctor, nurse practitioner, PA, whoever that goes through the science. And then they also have a patient guide. They have a lot of educational information. And I think that you would find it really helpful. And if you have a provider who's open-minded but maybe not aware of these tests, then that would be a good place for them to start. So better tests lead to better treatment, lead to better outcomes. I love good tests. I know that sometimes It's not fun because they're not always covered, but boy, can they make a difference in somebody's quality of life. With Microgen, it's pretty hit and miss. If you have Medicare, especially standard Medicare, I don't think I've ever had a problem getting it covered. Some commercial insurances will cover it, some won't. It's definitely worth a try and worth having billed. If you don't have insurance coverage, their self-pay prices, I think, are reasonable. It's in the $250 range for a test, which I know sounds like a lot for a P test, but let me share this with you. If you send a specimen to your regular lab for a culture, they will bill you per pathogen that they detect. I mean, the costs could really stack up and it can be pretty expensive. And this is so much more sensitive. They also have two combo tests that are discounted, the men's key and the women's key. What the women's key is it's the urine test plus a vaginal swab because those two are neighbors, and so there's a lot of shared pathogens that can help us figure out kind of what's causing what. For the men's key, it is a urine test and a semen sample. I feel like that's really, really important for men because I've had a lot of men who have a negative urine or it's a really low, low level, and it's kind of hard to figure out what might be the primary pathogen. But then when we collect the semen sample, it's a higher level. And the symptoms of that for men could be, yeah, your typical pain, but not very often. If a man has burning with urination, it's probably an acute infection or a pretty significant one. But what you're more likely to see are it could be incontinence, it could be difficulty getting the urine flow started or stopped or dribbling. It could be erectile dysfunction because if you have an infected prostate that's enlarged, that obviously limits the flow of traffic for everything going through the that that pathway, whether it be urine or semen, blood flow, all sorts of things. So you've got to think out the box when you're evaluating whether or not symptoms can be measured by infection. For men, I think it's also important to evaluate that if you have a high PSA. So PSA is your prostate specific antigen. And that's our general screening for prostate cancer. But what the PSA is, it's not a cancer marker, it's an inflammatory marker. So if you have higher levels of inflammation, you're going to have an elevated PSA. And while it's true that cancer can cause an elevated PSA, so can infection. So particularly if you have a PSA that's gone up and down, looking at infection is a really, really great place to start. We don't want to always jump to worst case scenario, and we want to keep prostate health intact to prevent further complications down the road. It's a lot easier to treat early rather than later. With women, we talked about how we do the vaginal swab and the urinary tract infection. Again, we don't know what all of these the chicken or the egg, if it's spreading from the vagina to the urinary tract or vice versa, but we do know that they're close neighbors. And we do know that if we don't treat both, it's going to be difficult to get better. The combination test price for the men's key and the women's key is, I believe, $289 right now. It's under $300. And so they are giving you that when typically you would be paying for two separate tests because you can do them separately. So it would have been 500 plus, and they're giving it to you for under 300. I think that it is well worth it when you look at the implications that chronic infections can have on quality of life, not just in the bladder area, but infection isn't isolated. If you have a chronic bladder infection, it's really not just hanging out in your bladder. You have blood flow to your bladder. There are things spreading other places. And I've had patients who we treated for infections that we found that we think and were probably there for years who report things like increased energy, decreased anxiety. Their body's not fighting this battle and the immune system's not having to be constantly active, and they just feel better. So With the microgen test, if you use that, you can get on the website if you need to ask about ordering kits, take information for your provider, see if they can order it, and they can help you interpret results. There is something pretty cool that they do with the urinary tract pathogens, especially with the vaginal one. I've seen this more recently because it can be confusing sometimes because they will list normal bacteria there too. And my guess is because of the way they've changed the report that maybe some people were overfiring and treating normal bacteria. So, of course, there's going to be lactobacillus there. And some people have high enough levels of lactobacillus that it shows up on the report because of the quantity, but it's not pathogenic. So they've got this little key now where P is pathogenic, C is commensal, meaning normal bacteria, or U if it's unknown. So that can help you make decisions. The next thing I'd like to dig into a little bit is how to treat these. The typical 3-day course of antibiotics is really, really inadequate. Okay. It could suppress symptoms, but it's really not going to clear something, especially something that's been there for a while. There are different ways to approach this. I think that the most helpful thing is to retest, treat, retest, because you could go with this just long course of an antibiotics. And by long, I mean a couple of months long. I like to treat for a minimum of 2 weeks before waiting to retest, and what we will frequently find with people who have chronic infections is that the picture of the bacteria we're treating changes, and that matters because not all pathogens, bacteria, or fungi, other things, respond to the same medications. So to just say, "Oh, this person has chronic UTIs, put them on Bactrim or put them on Macrobid for an extended period of time," that's going to suppress some things, but it may not be targeting the actual pathogenic bacteria that they have. It makes a lot of sense to wait a week after you finish treatment to retest so that if anything was just kind of simmering and is going to flourish back, that you have a better picture of what's going on. And it also makes a lot of sense to treat biofilms. We've talked again about biofilms in the context of vector-borne infections, but it's very important with a chronic urinary tract infection to address the biofilm because that is just trapping that bacteria in there and you'll clear what's around it, but it's got its claws in, it's not going to go anywhere. Ruth Kriz, Kriz, she is a nurse practitioner who's really specialized in this and has done a lot with developing some lab work that you can do to help us figure out your biofilm composition. We talked a little about the biofilm testing that T-Lab has for blood that can help us get an idea of what your biofilms are made of. But you have to be pretty aggressive. There are some combination biofilm agents that I like. There's one called biofilm neutralizer, biofilm defense, biofilm X, biodisrupt. There are several good companies that have made some really good biofilm agents that you can use. But for an infection that's been there for a long time, sometimes we have to be even more aggressive and be adding things like lumbrokinase, alpha lipoic acid, niacin, all sorts of things trying to just basically hammer away the defenses of these little bugs so that we can effectively get what's inside of them. There are things you can do on your own, but at some point, finding a good provider who really knows this, if you feel like you've been struggling with this for a while, it's going to be in your best interest to find someone who can walk you through it, help you figure out which supplements are going to work best for you, can switch up the antibiotics as needed, and can help you get back just a better quality of life and a better future. If you think again of just incontinence, the expense that that is over a lifetime, how it affects people's social life, how it affects their self-esteem. I mean, there are so many different things that incontinence alone can do. And I am not claiming at all that all incontinence is caused by urinary tract infections, but I am saying that it merits investigation. If you have a little bit of dribbling and you're 90, that may be expected. But if you're 40, 50 and you're incontinent, that's not right. Something's driving that. And there are things that you can do to help other than buying stock in Depends. I think there are other options out there for you. I am going to pause there because we're going to talk more in our next episode about some of the more intensive treatments that can be done if standard treatment fails. We're going to talk about how infection should be approached in men versus women because it is different because of our anatomy, and where you can go to find resources for providers who can help walk you through this process. Talk to you soon, and remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.